breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, and welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, Dr. Glenn Harrison. What's up, bud?
Oh, I'm excited about this one. I'm excited about most of our podcasts, but this one I'm really excited about. Let's just put it that way.
Yeah, excited to get it out of our folder.
Excited to get it excited to get it out of our folder, but I've seen this problem so many times anytime I'm on vacation. And I actually get approached many times while I'm on vacation where people are complaining about this.
Yeah. I mean, you think about it, and it's pretty common. Affects a lot of people. I think that a lot of people get really nervous about it, and that was one of the reasons. In fact, I actually got asked about this today.
Okay.
So, obviously very common. And we are going to be talking about why do my ankles swell? Or why do my lower extremities swell?
Why do my feet swell?
Yeah. If this happens to you, you might want to stay tuned. But otherwise, if this is your first time watching or listening and you have questions about your own health, make sure you hit like and subscribe, turn on notifications, because we will continue to break down common healthcare concerns, issues, or questions each and every week, and you never know when we might address something that is affecting you. So, without further ado, buddy, what are some common causes of swelling in the feet and ankles?
Drinking too much on the beach on a hot day.
Hey, it's like kind of all of them.
We're done.
Yeah, wrap it up.
Wrap it up. No, there's a lot of things that that can be the result of this pooling or inflammation or swelling in the feet and the ankles, and some of it might not be too big of a concern, but some of it could be be ready for the ambulance. It
could be a red flag, right?
Mm-hmm.
You want to pay attention to it. So
for sure. So one of the big things that should be ruled out is any kind of cardiovascular disease where you can't get blood back up to the heart. The heart is getting weak. So like congestive heart failure. What are some other things less severe?
I think you look at it and you could have like lymphatic buildup. So that would be like excessive fluid from, toxins or an infection or something like that. You could look at it as, is it natural? So when you look at like if it occurs on the beach, you've been drinking some Mai Tais or whatever, like your arteries are vasodilating, you're trying to get rid of some heat. The way that our body helps us to regulate our temperature is not only do we sweat, but we also will vasodilate, which means that our arteries get larger and it brings blood to the surface so that it can basically cool us through, what is that mechanism? I can't remember.
I don't remember.
Conduction?
Anyway,
Convection?
Yeah, we'll call it that.
One of those. I think it's whatever it is.
Your air conditioning system when your arteries dilate and you're trying to get rid of some heat, for sure.
Yes.
Those can be all of it. And I thought it was kind of funny. That's why I talked about the beach and people drinking too much, because there's toxins coming in. There can be that lymphatic toxicity or that lymphatic fluid building up in the extremities, a lack of a lack of contraction of lower extremity muscles like the calf that acts as a pump to get this lymphatic fluid back to the liver so the liver can get the toxins out of the body. So a lot of times we'll see this in warmer climates. People are on vacation. They're eating some not the best of foods and they're drinking too much alcohol, and they get naturally more dehydrated, more toxic. And on top of that, then they have all this heat that their body is trying to cool off. And then they'll say it never happens at home, but this week or this weekend, and who knows what their recreational history has been that week, but their ankles will swell up, their feet will swell up, and then there'll be all these weird lines on their feet from their sandals.
Mm-hmm.
Mm-hmm. I've seen it so bad in some individuals where their skin starts to crack on their feet.
Mm-hmm.
And if you've ever seen that, probably.
Mm-hmm.
Yeah.
Mm-hmm. Yeah, when it looks like their lower calf, like their leg is just all one big size all the way to their foot, right?
That's exactly right. Exactly right. And you'll see it more, you see it less with younger people, of course, So, if this is going on, well, and someone's trying to figure out what it is, well, I guess maybe look at if they've been poisoning their body and what the climate is and all of that stuff. But what would be some medical interventions?
Yeah. So, well, I do want to add this to in addition to what you said, like you need to make sure that's not a cardiovascular thing,
Yeah.
right? You need to make sure that it's not some sort of venous insufficiency where the valves in your veins and stuff like that are functioning the way they're supposed to. And then again, make sure that like it could be an issue with hormones as far as like, you know, aldosterone or something going on with the kidneys as well. So make sure you investigate it and that it isn't, you know, a bigger issue.
That's right. Don't assume it's just the Mai Tais.
Yeah, right. The Mai Tais and the hot weather on the beach. But as far as like, you know, as far as like interventions go, you know, if it's pitting edema, that's a whole different story. So what pitting edema actually is where you can actually apply pressure to the swollen area and it indents and it stays that way. That can be a more serious, a serious condition that would definitely need to be investigated medically, and you know, with the appropriate supervision. There are options as far as like if it's just truly swelling, you can use like TED socks or compression socks, you know, socks that go up above your knee and they're really, really tight. So it actually helps your arteries recoil and it prevents, it's like kind of a pressure gradient that makes the blood a little bit more difficult to get to your lower extremities. You can look at doing like lymphatic massage. That would be like a massage that emphasizes pushing excess fluid back towards your lymphatic drainage points. What else you got?
Well, I think you kind of covered all the bases. I think the most important thing is make sure it's, you know, if you're on vacation or something like this and it is just episodal, maybe it is just heat. Maybe it is just all that. But don't underestimate if there's any other symptoms of any kind. You know, talk to your doctor about it. Don't just dismiss it and say, well, maybe it was the Mai Tais. And no, we're not sponsored by an alcohol company. If we keep referencing alcohol in this podcast. But yeah, rule out all those things. I think that's the most important. There's some natural strategies once it's dialed in and rule out the very risky concerns. But again, compression socks, even in the natural model, lymphatic drainage, lymphatic massage can be pretty great. But I've seen that, and that's a temporary thing, right? It's a temporary fix because you're manually moving, helping the lymphatic fluid get back to the liver so the liver can get the toxins out of the body. So we can ask, well, is there too many toxins? Or we're not contracting the muscles enough of the lower extremities to pump the lymphatic up that we need to do these massages. Almost always there's maybe a combination of both. But the biggest one that I see is just toxic buildup for whatever reason, a liver issue, something going on. So then you can start running detox strategies, not only lymphatic massages, but start going. And I don't know if we've ever done any podcasts on detoxification, but I guess that's coming up.
Liver's kind of important.
Kind of important. So looking at the level of toxicity in the body, and there's going to be other situations that are associated with it, which I can't get into all of those, but it could be, you know, other skin issues and cognitive problems and other chronic symptoms can be associated with toxicity. So toxicity is a component of it.
Yeah, I think that one that I just kind of thought about when you were talking about the calf not contracting, maybe just like exercise.
Yeah,
like
walking.
Increasing cardiovascular endurance, cardiovascular health, you know, keeping your arteries really healthy so that they expand and then contract through a process that helps with elastic recoil, which helps move blood to the periphery and back up. Contracting of the large diameter muscles actually helps to force it back up naturally as well. So,
and you know, get off the stool at the bar and walk down the beach a few times, right? That might help. Get a little bit of motion. There's also detox efforts can also involve sweating naturally, and that could be wet saunas, dry saunas. Have you ever used any infrared saunas?
Yeah. Yep. I have. Yeah. Friend Emily has one and I love it. Shout out to you, Emily. Thanks.
Oh, nice. Nice. Yeah. They're very powerful, very, very powerful, very, very effective. But all those strategies can help if it's a toxicity issue that's being amplified in warmer climates and if more toxins are coming in the body. I know you already talked about increasing cardiovascular conditioning, and it doesn't have to be very extensive, really. It's where are you starting and how much are you going to push? And you talked about this before with interval training on a previous podcast.
Yeah. If you have issues with cardiovascular health, you should definitely give that one a listen, because I actually have read a book and read some studies about how they're using interval training to help rehabilitate people who have suffered from like heart attacks and strokes and myocardial infarcts. So If you've had something like that, or you have issues with your conditioning, or you want to get in better shape, or you just want to improve your cardiovascular health, give the I think we call it the most clinically effective form of exercising, and that can outline it for you guys there. So
that's right. And then there's more content on that. But maybe another thing that we didn't really talk about prior was salt intake. And salt has always been demonized; it's a bad thing. But depending on what kind of salt you're consuming in your body, you will retain more water. I've seen that a lot. So don't necessarily just avoid all salt, but be selective with the salt that's coming in. Table salt, sodium chloride, too much of that is just going to cause problems. Look at kind of making a transition into a mineral salt, like a sea salt or a Himalayan salt. That can actually help with these issues. So there's a lot to it, but I think it's a red flag. You get asked that question enough on vacation or anywhere. People's sandals are stretched and their ankles, you can't tell the difference between anything. It makes me, when I see it, in public, first thing I get nervous. Is this a cardiovascular case, or is this just a lymphatic buildup that there's other chronic issues that need to be addressed? But it shouldn't be something that we should just ignore.
Exactly. Investigate it, figure it out. And I mean, if it is just truly, swelling, there's a lot you can do for it. So
That's right. So that's all I have on this one.
Yeah, I know. I'm glad to get this one out of our file, buddy. It's been staring at us for weeks.
Yeah, hopefully it inspires some people to not ignore it, but have a little bit of understanding that it's not just random. And it's,
So if you guys got value out of this and you appreciated the content, make sure, again, like we talked about earlier, hit like and subscribe, turn on notifications, share this with maybe a loved one or friend or family member that has swelling on vacation and they got a little sausages on the end of their toes at the end, or at the end of their feet. And stay tuned, because we're going to continue to break down common healthcare concerns each and every week. You never know when we might hit yours. So till next time, buddy.
All right. Thanks. I look forward to the next one.
All right. See ya.